let's jump into a case study. So, and there's a ton of these, right? But this is one that just jumped out at me. And then we'll actually go into a case study of one of our actual customers. This was just a very public breach. And I wanted to share this because, you know, there's 845,000 patients impacted by this breach from Sutter Health. This is they got a ransomware attack from the MoveIt file transfer, and that was through WellTalk. They are a vendor operating an online contact management platform. They notified them of the attack. The breach occurred in May with an unknown actor exploiting the vulnerabilities to access the data and exfiltrate it. That was just the patient information. It didn't include socials. It did not include the financial data. But just scary stuff. And what I like to do is not, you know, scare our customers, but what I do is I try to find a breach that was similar to their organization's size and scope. And then when I'm talking with them, I can bring up these types of breaches just to kind of help them and guide them into how attackers were able to get in to the other organizations' networks. So let me go into a case study of a customer of ours. The customer's name is not really this, but it is, the rest of it's all, you know, real stuff. So the problem is they had a mounting compliance concerns. They were really trying to get a contract with a Fortune 50, you know, they're trying to get a contract and they couldn't get it just because they had a lack of cybersecurity maturity. And so their lack of incident response, they had poor HIPAA documentation, they had not enough really staff within the cybersecurity department to manage a lot of their concerns. And they had a big fear, right, of suffering from ransomware. And they had a lack of training within their organization, and they had mounting concerns with HIPAA. So this is sort of what we were able to provide them. An easy plan that helps them meet the requirements, comprehensive cybersecurity program, an incident response retainer, and end user training. And this is kind of what that plan looked like for that organization on a monthly basis. You can see right in the middle of the month, we put a HIPAA risk assessment that meets their annual HIPAA risk assessment compliance. And that is really the only thing this whole customer started with was they wanted a HIPAA risk assessment. And then we built out this entire other plan to help them meet the needs of their organization. So it a lot of times really does start with compliance, right? Because that is mandated, right? It's a requirement. So if you can help build out the rest of their year-long plan around all of the stuff that the HIPAA risk assessment. So we didn't start with the risk assessment, right? We pushed that one out to June, but we started with the vuln scan, and then, you know, review of their cyber insurance, incident response, planning, consulting, building out a plan. This included some other stuff down here, cybersecurity training, and this was monthly. So we did this stuff every single month for this. We're still working on this customer. So this is just a quick example of how compliance was used as a full and encompassing trigger for a lot of other services around cybersecurity.